The subject of this video is the U.S. healthcare system and its focus on your health. When we thoroughly think about it, does the present healthcare system really focus on your health? As a result of several recent conversations with some of my patients who have noted that the methods I've employed in treating their painful knees, backs, necks, hips, and other body parts are much different than conventional medical and physical therapy methods. I asked the different individuals who they thought was most concerned with their health. The four primary entities we discussed in the current healthcare system are physicians, hospitals, pharmaceutical companies, and insurance companies. Now, let's take a look at each part of our healthcare system and evaluate its interest in your health. Physicians. Now, physicians are taught to identify disease, make a diagnosis, and provide a treatment plan. Unfortunately, disease is emphasized more than health. The only procedures for which physicians can bill are procedures that treat illnesses and not procedures or advice that promotes health. Now, I feel that if reimbursement was available for teaching patients how to be healthy, then I believe physicians would spend more time emphasizing health rather than emphasizing sickness and how to treat an illness, which may have been prevented had healthy types of advice been given to their patients rather than the assumption that everyone is ill and therefore needs treatment rather than advice and encouragement on a healthy lifestyle. Physicians have expenses, including paying for their medical education, operating their office, paying their employees, supporting a family, hopefully buying a house, and even saving money toward college educations for their children. Because illnesses and the treatment thereof are the only ways that physicians can bill insurance companies or third-party payers, he or she is focused only on illness, the diagnosis of illness, and the treatment of illness, which many times leads to patient hospitalization and also pharmacologic therapies. Hospitals. In the business of running a hospital, the administrators must do everything possible to maintain a patient census that is nearly the capacity of the rooms available. Therefore, every diagnostic procedure that is in any way associated with the reason that one is hospitalized is performed, even though in many cases the results are simply normal. The tests are also ordered by the attending physicians not only because it helps maintain the census, but also its protection against possible malpractice claims in the future. The current malpractice situation that many hospitals and physicians find themselves encountering causes them to perform many tests and procedures to provide them with a safety net in case they at some point in the future are charged with substandard treatment. By performing all these tests and or procedures, the cost of treatment and diagnosis are both increased. If the hospital census is not near the maximum, then the auxiliary personnel, including nurses, aides, cafeteria help, janitorial help, security, secretarial help, they're all diminished because of a lack of need. Well, rather than lay people off from their normal work schedule, most hospital administrators attempt to keep their employees fully employed rather than unemployed or partially employed. Of course, by virtue of having additional employees at the hospital, the administrators can justify increased salaries because they are performing administrative tasks over a larger number of people that are under their responsibility. Pharmaceuticals. Well, in reference to pharmaceutical companies, they are much more profitable if they can justify more medications that are applicable to more patients to solve almost any of the possible diagnoses of which are arrived at by the physician. Pharmaceutical companies are only profitable if they can market medications in the amounts required to fully reimburse them for the research and development costs, and also then return a significant profit to their investors. Most pharmaceutical companies do not make medications to primarily improve your health, but rather make medications to treat disorders or diseases that are diagnosed by physicians because of a profit motive. Once again, your health is not a primary focus of the pharmaceutical companies, but rather your disease, as is also the primary focus of your physician or healthcare provider and also the hospital. Insurance companies. Now, let's take a look at the insurance companies. Many insurance companies have tried to market themselves as the primary health provider agency. Most of them would prefer that the patients become loyal to the insurance company rather than loyal to any individual physician. By altering the customary relationship between the physician and the patient, the insurance company has significantly increased its latitude of control as to where the patient will seek and receive treatment. There is much marketing today to convince the public that various insurance companies are focused on the patient's individual health. However, if the patients become healthier, then there is less need for treatment and diagnostic tests that result in less billing and payment for medical services by the insurance companies to the hospitals and to the doctors. If the payments to the hospitals and the doctors reduce, then the insurance companies have no basis to continue to increase their premiums on their insureds. It is very important for insurance companies to continue to increase their premiums in order to continually make more profits, even though some have labeled themselves as not-for-profit organizations. The insurance company's approach is that if they are receiving a 4% profit on a pool of insurance premiums totaling $3 billion, it is much more profitable for them to make the same 4% profit on a $6 billion pool of insurance premiums. So, as you can see, even though the insurance companies state they are trying to do everything within their power to help you be healthier, it is not in their financial best interest if they're receiving 4% of the pool of less premiums, which equals less income. More premiums equal more income. Therefore, to help you be healthier would be decreasing their financial base and also the need for some of their employees, and the need for the executives who are paid significantly higher salaries for all those employees. So in summary, it becomes very obvious that you alone are your best advocate in your attempts to remain healthy and vital as you age. In our ever-changing healthcare system, I believe that it will become even more important that we, as individuals, take charge of remaining healthy and become less and less dependent on the various parts of our healthcare system, which unfortunately has very little incentive financially to help us remain healthy. Our choices and subsequent actions are becoming ever more important in protecting us from chronic types of diseases and minimizing our exposure to unnecessary testing and treatments merely based on the present reimbursement system. I still believe that nearly every physician is trying to do the best job possible, but their focus is altered because they have expenses and must invest their time, education, and energy in areas that are approved for payment by the third-party payers. In President Obama's inauguration speech, he states that he will focus on lowering the costs of health care and yet maintain and expand health care to cover many more people. Historically, when the government is more involved in delivering a service, the costs increase and the service is diminished, or at least much harder and takes longer to access. Now, my initial review of the Affordable Health Care for America Act reveals that there is little incentive for us to focus on our health, but rather the focus is on how to access health care after we're sick. There is essentially no financial incentive for physicians or the public to really focus on health. If doctors were paid to teach patients how to be healthy, and if the public were to get a tax break somehow, or supplemental income, if they kept their health within certain measurable parameters, then I believe we'd begin to see overall health changes in our society. We are a society that is usually motivated by the prospects of financial rewards for our efforts. I realize that changing personal behavior is challenging, but within the right incentives, miracles resulting from motivation can happen. Now, as far as getting and or remaining healthy, it's like swimming upstream. It's much more difficult than floating downstream. But the farther you swim, the fresher the water gets. Floating downstream is like following our future healthcare system. It's much easier, but you end your trip in a crowded, stinky, infested swamp or delta it's ideally suited for sickness, deterioration, and early demise. Now, if you need additional information on how you personally should approach this crisis, please give me, Dr. Jack Lynn, a call at 949-376-4342 or contact me via my website, www.tdfit.com. That's Time Defiance Fitness, www.tdfit.com, and leave me an email message or phone me. I will assure you that I will return your call or your email and answer your questions. You know, your health is in your hands. Take charge of it. Don't put it in the hands of others. With you in charge, your probability of being healthier as you age and remaining vital is so much higher than if you merely rely on a flawed healthcare system that has no financial interest whatsoever in helping you remain healthy. And I'm sorry to say that, but I've practiced for 38 years, and I can tell you from experience that our system today is not focused on you. It's focused on bureaucracy. Bureaucracy will not make you healthy, but you can. Please give me a call and have a very, very healthy day.